as you know, that in the last couple of years, combating COVID-19 became the focus of the whole world. The health challenges are, and the priorities for the health challenges are now different. How did we do it? And we start with the UAE. What was the recipe, Your Excellency, that you were able to do in order to manage where we are now and to host a huge conference like this?
I think the United Arab Emirates have many different advantages. Readiness, infrastructure. The pandemic was something new for everyone. For sure it was, and this was the biggest challenge, that we didn't know a lot about it. But whomever succeed in a better way than the others was who have more readiness, let's say, more resilience, let's say. And I think one of our biggest advantages in here, the United Arab Emirates, that our leaders in a way structured a concept of healthcare, that healthcare system have to be provided in an excellent way for everyone. And one of the advantages we have that caused this, that we have 200 different nationalities. So imagine you have 200 different nationalities acting as one heart or as one body. This was one of our strongest or best element that helped us a lot. We had more than 200 different experiences, and they really wanted to fight this together. And it ended up with an excellent result, alhamdulillah.
So the 200 nationalities were a source in finding, not a challenge for you?
Definitely. It was absolutely a very strong element to help UAE. And the key in that was our founders gave us certain values that helped everyone to be part. It wasn't local and resident, it was everyone who live in UAE will protect UAE.
Fabulous. If we go to Seychelles, Your Excellency, in an island, how did you manage it?
Well, Seychelles, as you know, is a small island in the middle of the Indian Ocean. So after COVID, when borders started closing, and we really, well and truly locked down, because everything had to be from within. And as a small island, obviously, the resources are limited. We do not have as many health workers as in other bigger countries, nor could we get people to come in because the borders were closed. So we really had to dig deep into our resources to look at how best to mount an effective response. And we did have certain things which were in our favor, advantages such as having a good public health system. We had experience of health, airport and port health. We had a good system of public health laboratory, albeit not offering all or being able to do all the tests that we realized then we needed to do, but at least the infrastructure was there for that. But we also had a lot of challenges and vulnerabilities. We had the challenges of inadequate infrastructure facilities. We couldn't handle the admissions of so many people who were affected, and also other infrastructure plus the logistics. But all this added, because I believe that all these experiences provided learning opportunities, which even during the 2 years of the pandemic, we've used to improve the effectiveness of our response.
Well, in Greece, you even created an added title to the health ministry, which is the mental health. And as we all know, the term mental health, we only started to become familiar with during the COVID. And it looks like it's also staying with us. How did you manage, or where did you come this from? And also, to what extent you felt that the mental health was really a responsibility of the government?
In the beginning of the pandemic, we saw that it had impact, a great impact in the mental health of people. both children, adolescents, women, the general population, and of course the elderly. Our Prime Minister, Kyriakos Mitsotakis, created a portfolio at the Ministry of Health which was specially dedicated in mental health and addictions. This was in order to ameliorate our services and give first certain services to the victims of COVID that were in the hospitals through digital means, through tablets, and then to give psychosocial support to their families, but also to give psychosocial support through means that were designed to be given to remote areas. This was very early in the pandemic being seen, and also what we did was also to hire more doctors, psychologists, and social workers, and also nurses that could help our national health system. Last but not least, it was also our effort to give special care to children. As we saw, the pandemic struck children most of all. The lockdown was a very stressful period also for the general population, and it created also anxiety, it created panic attacks, it created special visits at the emergency units of the hospitals, and also for the elderly because they were, and those who were working. Those who worked at home had also big problems that had to do with family conflicts. They were all together, and we had to give also special help to them. So that was why we created this portfolio, and in order to address the problem with the addictions, because during COVID-19, we saw also a rise in addictions. We saw extensive use of the internet, and many of our children and young people were really into them, having also big problems with also cyberbullying and other certain factors that devaluated their health, their mental health.
Unique experience, definitely. And I'm sure now that the WHO, you're looking everywhere, and you can tell that the vaccine, the ICUs, there are lots of demands that we were not really considering them as a priority on our priority list. To what extent this affected the supply chain process?
Well, I mean, first, thanks for having me on this very distinguished panel. It's a real privilege to be here and be in person. And I think you've heard from the examples here that the approach to COVID has been and needs to continue to be so comprehensive, covering everything from our work with people. Every answer was about people and how people are at the center of this. In terms of supply, in terms of tools, we have many. We have everything from the use of masks to even distancing, to hand hygiene, to therapeutics, to diagnostics, to vaccines. And I'm sure none of you want to continue to talk about COVID, and I would give nothing more to stop talking about COVID. But unfortunately, we have quite a ways to go. And the use of those tools, access to those tools, making sure that we have supplies to those tools, and we have people who know how to use them, we have governments that have rational and strategic policies, is absolutely essential. We've seen in this pandemic that supplies were significantly limited, particularly in the beginning. And if you think in the beginning of masks, very limited production of masks, and we still don't have masks and respirators being used by our frontline workers around the world as much as they need to be. But vaccines continue to be needed. And it is astonishing that we have so many safe and effective COVID-19 vaccines. Astonishing. I'm sure all of you were sitting in meetings thinking in the beginning of this is that, will we even have an effective vaccine? And our initial target product profile was 50% efficacy for preventing severe disease and death. And we have 80, 90, 95, 98% efficacy at preventing severe disease and death, including against Omicron. So these are astounding, and they need to be used. So it's investment, and it's maintaining that vigilance for production, for tech transfer, for access to be able to purchase them, and then turning vaccines into vaccination.
When you say investment, does that mean that we're still going to live with it, or there's more coming?
This virus is with us. So there's a lot of people that say learning to live with COVID. I really I struggle with that phrase because some use it to say it's with us and there's nothing we can do when we give up. And I refuse to accept that. WHO refuses to accept that when we have 50, 60, 70,000 people a week that we know about that are dying from COVID, not to mention all of the other diseases that people can't get care for. But the virus is with us. There's no question about that. And living with it means living responsibly and doing what we can to save lives. So we have this latest variant of concern, Omicron. It will not be the last.
Your Excellency, are you ready to face any God forbid future pandemic?
I think the key will be readiness for the future. And thank God we were even more than ready. I see faces here with or without masks. And the audience who've been really great heroes. They were ready. Our infrastructure was ready. Not to face something that was unexpected. It's in reality, we were talking about disease X in 2019 and 2018. We weren't expecting that it's going to be very fast, but in the end of the day, we did invest. Government of UAE and leaders of UAE believed in a proper health system. That's why they invested earlier in this. I think partnership with the private sector, who really did great in the pandemic. Getting everything together. One of the key elements, we have an entity, the NCEMA, everyone knows about it, is the National Crisis Emergency Management Authority. With this, getting everybody together, we really managed to move forward very faster than anyone else. And because of this, because of a proper coordination, I think we can do even better in the future. We learned a lot of good lessons from this. We learned that we have to always fight or be always together. We have to cooperate between each other. We have to rely on proper statistics, good systems, a lot of small things here and there, but at the end of the day, putting all those together is the key.
But that's very, very important, yes. But some countries, they cannot afford to have any future pandemic because they have limited budget and they have lots of requests and lots of demands. What's the case with Seychelles? Are you ready?
Are we ready? I think, as it's been said, COVID-19 has taught us a number of lessons. It has helped us make an assessment of the system, health system, government system, private system. And so as we stand today, we're better prepared than we were in 2019 or 2020 when we had our first community transmission. Can a small country like ours, with limited resources, be prepared for the enormity of a pandemic? I think whilst we have a very good public health system, we've realized that this needs to be strengthened a lot more to be able to mount a very effective response. I think with the resources we have done very well. And, but we're also aware that with the evolution of the virus, we do not know our real enemy. And therefore, you need to be prepared for any eventuality. And I think this is where the issue of resources come in. You can be prepared maybe to go along and mount a very good response to COVID-19, but this would be at the expense of other services that are equally as important, because when you have so many health workers, you can only stretch what they can do to a certain extent. So if you're pushing them into the COVID-19 response, then the non-communicable diseases and the cancers which are not going away are sort of going to mount. So it is a very tight balancing act, which I think countries with low level of resources have got to sort of really get it right. And it's been said that WHO, we do have a lot of support, a lot of guidance, more now than we did when we were hit with the pandemic. But for all this, they need to be used, we need to have a system that permits their effective use. Otherwise, they go to waste. And as it's been said, when you live within a region that has maybe the preparation, the resource base is still very low, then there's always that vulnerability that what needs to be done is not done. We've learned with COVID that no one is safe until everyone is safe. So if you live in a region where the vaccination rate is still, at below 20 or below 30, so unless you live in a tighter, lockdown, you're going to have that kind of interaction with other countries. So the preparedness, you can prepare, but I think it's also, you need to know who your enemy is in terms of COVID-19. We've said, is Omicron going to be the last variant? I think Maria just told us, possibly not. And I guess for each variant, there's a different level of preparation. Thank you.
And with the mental health, is that something that you consider it as a priority on your budget when it comes to the health ministry, for example? Because the productivity of the people depends also on their mental health. So it goes hand in hand. How can you manage it with limited resources?
As WHO put it, there is no health without mental health. So it's our priority to augment the funds that are being given to mental health, and we augmented it by 62%. And also, what we are trying to do in Greece is to create more infrastructure. And we must see COVID-19 pandemic as an opportunity to ameliorate our services, to give services and give also data to the people, because we know that stigma is a paradox that don't help record all the victims of suffering of mental health, and also to create new digital tools to help with the mental health services. Also, it is very important to create infrastructure, which means, and this is what we're doing in Greece, to create day centers for children and adolescents, and also for the elderly, for dementia and Alzheimer's, also to create residential areas that the people can live in, and also mobile units. Mobile units have been proved to be very helpful, especially to go to remote areas. We used mobile units also for the vaccination of the people, and the vaccination was a factor that helped the mental health, gave a sense of a push to mental health also. And this is the period, in my opinion, that we should fund more the services in mental health. This is a global procedure. It must be a global cooperation. Also, big organizations as WHO and the states should cooperate on that. In Athens, we held the Athens Summit that was created and devoted to mental health, and we signed the Athens Declaration aiming exactly to put the states to adopt mental health services in their health system. Also, what, in my opinion, could be done is to give to remote areas through telepsychiatry the means to give support to the people that live there,
right,
either in a desert or in remote areas such as mountainous or as we have islands.
Very good. Now, Dr. Maria, we're still talking about COVID, but I'm sure that the map is huge when it comes to the other responsibilities and other issues and challenges that you're facing as WHO. And 2023 was supposed to be reaching the targets for the triple billion. So where are we now?
Well, I mean, we're certainly off target of where we need to be in terms of protecting billions of people on the planet. The Director General has talked about this quite a lot in terms of how COVID-19 has altered our trajectory to deal with this. But I think everyone sitting up here, everyone listening here recognizes that COVID-19 is one of many challenges that we all face. And in the beginning, we were certainly overwhelmed at a global level, and many countries are still overwhelmed by COVID-19, with still significant burden of disease. It cannot be at the expense of other conditions, other issues in the health sector and beyond the health sector. And so for us, we have many surveys that are done that look at what has been the impact of certain vaccination programs, access to dentistry, access to mental health services, cardiovascular diseases, diabetes, problems that have not gone away and in fact have been even more exacerbated in this. We're now starting to see cancer patients who have not had their treatments for 2 years, and what we will start to see from this. So the impacts of COVID are direct and indirect,
Right.
and it is really critical that we get back on track. And I think everyone's used the word balance. So what we're looking at into 2022 and beyond, because we will have to live with this virus responsibly, how do we balance and remove the death and disease from COVID-19, which we can do right now. And I hope people hear hope in our voices, because there is huge amount of hope, tremendous amount of hope at reducing severe disease and death with vaccines, with earlier clinical care, with good diagnostics, but also reduce the spread, because this virus is evolving and it's changing, and we have to be ready for that. I think one of the things most countries have struggled with is agility. How do you adjust what is needed to be done? All of the tools, using that layered approach as the situation changed. Every country is in a different situation. We look out in the audience and everyone here is wearing masks. And that's wonderful, because it's a simple tool we can use to help each other, to help ourselves, to help our loved ones. But in many countries, they've gone from all to nothing, and
Right.
all to nothing. And I think that's been very, very difficult, and it's also eroded the trust of people in populations, because we keep moving the goalposts. So what we are doing as an organization to support all of our member states and everyone everywhere is, how do you adjust and balance saving lives, saving livelihoods, saving the long-term consequences. We haven't even begun to discuss long COVID and what that even means, but at the same time, reduce the spread. I didn't use the word lockdown. So we're not talking about all or nothing. We're talking about smart, strategic approaches and maintaining systems and enhancing systems that have been built. The other huge fear that we have is that some systems are being dismantled right now. We're not going to be able to keep all of this up. How do we maintain, enhance, nurture what's been built for COVID-19
Right.
for the future? Because this will not be the last. The disease X, the next disease X is out there.
And I think you'd like to say something, Your
It's
Excellency?
when it's a certain question. When I said we are 100% ready, in reality, we cannot afford not to be ready. We have to be ready. The key is, first thing, listen. If decision makers were listening to Dr. Tedros 2 years ago, at least certain precautions would have been done in certain areas. If they listen to the expert, if they trust their health leaders. The example is UAE. It wasn't, we were talking about it. Our, as I said, structure was ready, not for a pandemic like COVID, but in the end of the day, we were ready concept-wise, and we knew that there is something could happen. That's why we have the crisis authority. That's why we have a certain kind of a strong partnership with the private sector. And that's why, this is when I say, in reality, we cannot afford not to be ready. Because first thing is to listen. And then a lot of things are affordable, and one of them is this. Unfortunately, a lot of people are not wearing it. I'm not talking about our audience here, but this is a key, and it is not so expensive.
True, true.
So that's regarding the
But I'll stay with you as well, Your Excellency. Before COVID, we used to hear a lot of plans and actions were taken in order to face some of your challenges, health challenges for the population. One of them is obesity, for example. Is that coming back now to your priorities, or you're still busy with making sure that the COVID is under control?
Non-communicable diseases kills, I think, around 41 million a year. COVID did 6.1 till today, which is an average of 3 million a year. See the calculation. The ministry, my ministry called the Ministry of UAE of Health, it's Ministry of Health and Prevention.
Prevention.
So the target is to prevent diseases. For sure, everyone is almost back on track. Challenges of treating cancer, non-communicable diseases, creating awareness, we are back to track. Of course, with focusing on COVID on the side, because again, it can't take us from our real life. We took this formula a bit earlier. And of course, you lived in here, Caroline, for a long time, and you know, it was the first few days that we were not uncertain like everywhere else. And then we started that we have to live our normal life with the precautions, with the government providing, of course, and the private sector providing the best available for everyone on the ground. And that was the formula. We hosted Expo with 192 countries, one of the best expos ever, and with almost 25 million visitors in a pandemic, which is a huge challenge. But again, the formula is working. You can see the leaders of the health sector in the hall now, and they are wearing their masks, which means there is a kind of understanding. So, and there is an existing structure that helps. So it's not to lose focus on the real sector, on the real issue, which is the health. And of course, it's also to focus on something that's going to stay with us, as Maria mentioned. So we have to focus on people. Non-communicable diseases is a big challenge, and we are focusing on it. Mental health is one of the biggest future challenges, and existing and future challenges. A lot of other things, but of course we have another, on the other way around, we have digitization that can help us a lot, getting more information by getting all the systems together. A lot of new system, we saw how can we achieve a vaccine within 100 days. We already started our own trials here in UAE, our own facilities. We started changing our laws to get the chance and give the chance for more R&D. So a lot of those small pieces to put together that will help us keep on going on or maintaining a proper health for everyone, and at the same time, being ready for any pandemic.
You mentioned in the last sentence that the term maintaining, and I think that's going to be our challenge for the near future. How are you going to maintain it? Do you have your own plans already, and you're starting now to implement it in Seychelles, please, Your Excellency?
I think we need to be looking at health emergency as always one of the priorities of health, but also one of the priorities as COVID has really brought home to us, the whole issue of multi-sectoral approach, health in all policies in government, so that because when COVID hit, it was all of government who came together to mount the response and to make the response more effective. So I think using that same sort of approach to ensure that you maintain the kind of, maintain and strengthen the health system that you have to address other issues in health would be, we need to really work on that and strengthen it. But amongst all the discussion about COVID, I think a lot of the lessons, a lot of things that's happened will also assist us as we move forward with our other priorities in health. For example, we've talked of the mask, that personal responsibility which we've all adopted to wear a mask wherever we go, not only to protect ourselves, but also to protect, our neighbor. I think that same as self-responsibility, if used for prevention of other conditions in health, which very much will really add to, us addressing our other priorities. The way people came together to provide the support would also assist us within our mental health issues, the psychosocial that we require. So, and all the systems that we've put together to address COVID, will help us as we work with the other health priorities. So I think within COVID, as health emergency as a priority has added strength to other health programs.
And I'm sure, tourism in Seychelles and Greece are vital. So that's why you also need to move, but you also need to maintain it to maintain the credibility and the trust from those who are coming to you. Are you ready for it?
I think yes. Our main goal, and I think the goal of all governments, is to leave no one behind, to have a health system that gives access to everybody. And I want, in that content, to congratulate the Ministry of Health and Your Excellency, the Minister of Health, for giving access to the health system to everybody, because we must leave no one behind. And also, a very important thing, which we are also trying now to do in Greece, is to ameliorate and make all the health systems connect to each other. This is something you have already done here in the United Arab Emirates. And it is very important to have each person's files so he can find specialized care wherever he goes, not only in his country, but anywhere in the world.
Yep.
Last but not least, I think it is very important to see that we must ameliorate our services in order to help also in external situations, in earthquakes, in fires, and in special cases that we need to cooperate together. We did that in the recent fires, because as we know, the climate change has made very important and has very important aspects having to do with the health.
Yep.
We have reached that with mental health units to help in the field when the earthquake and the fires happen. So closing my argument, I want to state that our cooperation, the state cooperation, listening, as Your Excellency, the Minister has stated, listening to each other is very important to form our strategies worldwide.
I know that we're running out of time, but I have to ask this question, Dr. Maria. We were talking about the trust and also the role of the media. Remember, that 2020 was the best year ever in the history of CNN because people, they care for their health. Are you optimistic that the people are wise enough now to continue and to keep this trust and also go to the right sources and the information and the government that they trust? Or you're still hesitant?
I'm very optimistic, but I do think that, those of us who have had a forward-facing role, which was never, ever my original intention with the job that I have. It's a responsibility that we have to speak openly, honestly, communicate uncertainty, be hopeful, be realistic, but we have to maintain that trust. So it's very hard won, but it's very easily lost. And globally, we've never seen trust at an all-time low. So it's very different by very different countries, of course, but it's something that we need to work on. We have an informed world out there. Access to technology and information has never been as high as it is. There's a lot of misinformation, disinformation, too much information that's out there. But we have a responsibility to ensure that there is good information and that you can keep coming back to us to explain what we know, what we don't know, what we're doing to find out.
Transparency.
And what you need to do to keep yourself safe. Yep. So I'm very hopeful. But I do think we have a lot more work to do in this space. So
I think as long as we are on the right track, at least we are still, it's a long way to
yes.
reach our target, but we're there. We're on the track.
Yeah.
I'm really sorry. I wanted to open the floor for questions and answers, but unfortunately we're running out of time. Thank you very much for the audience, and thank you very much for the member of my panel.
If you allow me for one small comment.
Well, he's the minister. I will let him say.
Thank you very much. We have the WHO with us. We have a transparent media with us, and we have heroes with us. So let's give a big round of applause for all those three.